Hello everyone, my name is Ruben Blackstock from the NHS Institute for Innovation and Improvement. I will be your technical support for today. Thank you for joining the second webinar of Transforming Care and Staff Engagement Through the Power of Social Media. Today's session is called What is a Tweet? Learn how Twitter can revolutionize the way we engage others and improve care. I have muted all of you upon entry to reduce any background noise. If you are having any technical problems, please send any questions via the chat box, which is found in the bottom right of the corner. Please select Host from the drop-down menu that will appear when you click on the box next to the Send To. If you are having any questions and comments related to the presentation, again, please use the chat box, but this time please select All Participants from the Send To box. Alternatively, you can raise your hand using the little hand symbol that is located underneath the Participants box if you want to be unmuted during the discussion session. Please make sure that you have entered your attendee ID number when prompted dialing in. Otherwise, we will be unable to unmute you during the discussion session. I hope you find today's webinar really useful and that you gain some valuable information. I will now hand over to Helen Bevan.
Oh, hi here. It's Helen Bevan from the NHS Institute for Innovation and Improvement, and I'm your chair for this session. So I'm absolutely delighted to welcome you to this web seminar, What's a Tweet? Learn how Twitter can revolutionize the way we engage others to improve care. And I'm delighted to introduce our speakers, who are Ajay Puri and Christina Cruz from the British Columbia Patient Safety and Quality Council. Now, we invited Christina and Ajay because they're leading some of the most innovative work in the world on the use of social media in healthcare improvement in general and the use of Twitter in particular. And this is actually the second time that I've been in Twitter class with Ajay and Christina. And the last time was actually physically face-to-face. So I went to their Twitter class in Vancouver, Canada, and I was with a big group of healthcare improvement leaders. Most of us were in our 50s and 60s. And anyone who says that an older person cannot become a Twitter all-star, doesn't know what they're talking about. I think that there's real potential for all of us. And, when we think about health and healthcare improvement and we look across the globe, globally, we can see just what an important platform and mechanism for communicating and sharing Twitter is becoming. And I think that, all of us that work in healthcare improvement can really gain by getting engaged, learning the skills of Twitter and becoming active in the use of Twitter. So I'm delighted at this point to hand over to Ajay and Christina. What's going to happen is they're going to take us through the presentation, and then there'll be plenty of time for questions and answers at the end of the presentation. So I think that Ajay is going to start. So welcome, Ajay.
Thanks so much, Helen, and thank you to your Institute at the Innovation of Improvement. We're very honored and humbled to be invited to come and speak with you guys and share some of our journey with you. And we look forward to having a great conversation over the next hour and a half with you. So thank you. So should I just start then?
Yeah, go for it, Ajay.
All right. Well, thanks again, everyone, for joining us with us on this webinar. We look forward to having a good conversation with you. As Helen mentioned, we had some fun back in March, and we'd like to continue that fun over here with you on this webinar. So the title of our presentation today is What's a Tweet? Learn how Twitter can revolutionize the way we engage with others on how we can improve care. And just to mention, Christina, our executive director, you can find her on Twitter using the following, I'll just highlight it, handle. So it's CK4Q, and you can also chat with me on Ajay for Quality. So before we get started, we just wanted to reemphasize that we're using a hashtag here, and I know some of you guys are probably new to Twitter, but if you wanted to, just use this hashtag and it will go into the conversation on Twitter. In addition, if you'd like to contact our organizations on Twitter throughout the chat, you can use these ones at the bottom here. So that's us at the Council, the BC Patient Safety Quality Council, and also the NHS Institute for Innovation and Improvement. And also, we wanted to mention, if you haven't already, we would like and encourage you to download our Twitter for Healthcare Professionals guide. This is just an introductory guide to get you familiar with Twitter. So in case you weren't able to follow some of the conversation we've had or have questions, this is a good, useful guide for you to refer to after the conversation and during. And in addition, throughout the conversation today, we'll be referring to this guide. And you can download it at this website right here. Okay, we'd like to start with a poll, and we'd like to ask the question, how would you rate your experience with Twitter? Are you a newbie, an amateur, are you comfortable, or a superstar? Hopefully, Ruben, you're able to set this up, and once you see it, you'll see it on the right, and all you have to do is select one of your answers and submit it. So I think the poll will be closed in about 5 minutes. So you've got 5 minutes to answer that. Okay, just to give you an update on what to expect. So we'll basically explore how we've been using Twitter here at the Council in British Columbia, Canada. And secondly, we hope that you gain some practical skills on how to become a Twitter all-star, and that will help you and your organization succeed. We won't, unfortunately, be able to delve into all the topics, but we will try to cover as much as we can, and we'll make it as useful for you as possible. And secondly, we know that when we do these introduction to Twitter, there's quite a big spectrum of people, from people who've just started their account, which would be an egg as a photo, to those that are more comfortable or more that are all-stars. So we'll try our best to handle that continuum of people using it, but our target audience will be somewhere in the between, so the amateur to comfortable. So hopefully everyone will be able to follow along. And feel free to use, as I mentioned, the Twitter hashtag NHS tweets, or use the chat box to the right if you have any questions, and we'll be able to answer them that way. So over the next hour and a half, here's 5 things that we'll be covering. First, I'll just briefly highlight some of the stuff from our July 10th session. Second, look at some of the lingo. So that's some of the basics of how to talk in Twitter. So like you're learning another language like Spanish, or if you're learning French, we're trying to do that with Twitter as well. There's some lingo that you need to know to get you really good at speaking Twitter language. The third thing we're doing is looking at 10 things to keep in mind while you tweet. These are just some best practices that we've gone over the last 8 to 10 months, and we thought they might be useful for you as well. And feel free to challenge us on them as well through the chat or on Twitter. Fortunately, we're going to try an experiment as well. This is going to be live, and this is where you get your hands dirty. So whoever has a Twitter account, we're going to be hopefully working with you and seeing if we can try something on Twitter together. So that's the 4th thing. And then, of course, I'll be handing it back to Helen to see if there's any questions from the floor, and we'll try to answer as much as we can. So those are the 5 things that we'll try to cover. Okay, so let me start with just telling you a little bit behind who the Council is. We started about 3 or 4 years ago, and our vision is to develop a sustainable healthcare system built on a foundation of quality. Our mission is to provide a system-wide leadership through collaboration with patients, the public, and those working within the health system in a relentless pursuit of quality. And for those that were able to attend, we had a session last week with the NHS Institute for Innovation and Improvement, which was our journey on using social media in general. So hopefully some of you were able to attend and found some value out of it. We had a lot of fun, and we wanted to thank everyone who did participate. If you look at this, this is just some of the analytics that we were able to pull using online tools. So what happened was we had 338 tweets that happened. We had 112 participants, and can you believe this? We had an average of 3 tweets per participant. which was about 15 tweets per hour. And this was during the session, which was fantastic. Here's all the people who were mentioned, and then these are the people who tweeted, and then this is the impressions. So we reached these many people just within that last hour of our chat. So that's more than 200,000 people we were able to reach via Twitter in 1 hour. So thank you, everyone, for participating. We had a lot of fun. Now, if you missed a session or if you wanted to view the material, not to worry. We actually been able, with the help of the NHS, been able to document it for you. So as you know, if you have attended these experts on call, you can find all the information on their website. And also, we've been able to put our slides up on SlideShare. And if you've been following Twitter today, we've actually posted these slides that I'm presenting on SlideShare already for your behalf, and you can follow along. If you go to SlideShare and you type in our council name, you can find it, or if you go onto our Twitter, you'll be able to find the link. The great thing about SlideShare is they actually showed it on their main website. This is one of the top 10 websites in the world, and they actually showed our slides that we did with the NHS last week on the main page, and that's gotten us over 1,000 views. I think we're up to 1,200 views now, so thanks again for doing that. We've also been able to, with the help of the NHS, post our session on YouTube, so feel free to watch the session from last week. And lastly, we've been able to put the transcript of all the Twitter chat. Thank you for doing that, and that was done by Simplor. And we're able to basically follow every single tweet that happened for that session, and you can follow it on the transcript. The next slide actually has all the links for you as well. So feel free to click on any of the links and learn more. And just some of the quick highlights, I'll go over them quickly. We wanted to just say overall there's so many tools out there, right? So we have Twitter, that's what we're talking about today. There's Facebook, there's WordPress, there's Flickr, and YouTube. YouTube is for video, as we know. Flickr is for photos. WordPress is for web design. And Facebook, as we know, is a big social networking site. Fred Cavassa has actually put together a social media landscape. Feel free to use this diagram. As you can see, it's under the Creative Commons license. And what he shows is that people use different platforms like desktops or smartphones, and what they try to do is have conversations or interactions. The beauty of this diagram is it shows all the different platforms that are out there, and they categorize them into different topics. For instance, publishing, which is where WordPress comes under, and sharing, which is where YouTube comes under. And then there's games and networking and buying and localization. As you can see in the center of it all, they say Facebook, Twitter, and Google Plus are at the center, meaning they actually combine all of these different types of categories all in one, and they're trying to become the place where people go. So is there actually a strategy that we can employ when we think about social media and engagement? Well, one of the models that we looked at once we reviewed all the things that were out there, we found that the post method was a wonderful tool for us to really look through all these tools and sift through them. This was developed by John Burnoff back in 2007, actually, and he works with Forrester. And it's basically a systematic approach to social strategy. And I won't go into the details, and you can hear more about it from the last session, but the main points are that people ask organizations and other individuals, where's your Twitter? Let's set up a Twitter, or let's set up a Facebook. We really need those tools. I think the first thing that we realized is that it's great to be on all the platforms, but it's difficult to really look at the resources if you're everywhere at once. So we use this tool to actually think about the strategy behind that first. And that's one of the reasons why we selected Twitter. But we wanted to look at the people that we're trying to assess and what their social activities are. So that's the first step. Who's our target audience? From that, then you choose the objectives of how to engage them better, and then you develop a strategy around how to see how their relationships will change over time, and then you choose your technologies. So it could be email, it could be using things like we said, YouTube, or it could be other tools where you want to choose the best tool for what you're trying to accomplish. And then, of course, at the end, the things that we like in quality improvement, which is evaluation, developing ways to measure success. The other thing we discussed last week, which will be useful for today, is that you have this engagement pyramid. These are 6 levels of how to look at individuals within a campaign or something that you're working on and you want to help promote. You have people, for instance, on Twitter who just observe. They just see what people are saying and they listen. Then you have people who follow. That's when you have people who follow you and they're really looking forward to what you say next. Then they have people who endorse. So for instance, if you have a call to action, say you want to make a big change in the healthcare system, they start pledging on, and that's the endorsing level. Then they contribute. They want to participate, and they want to actually give something back. And then there's the part where you get up on the ladder where they own the process. And then lastly, it's leading. So on Twitter, hopefully we'll be able to show some examples on that, and you can see how this engagement pyramid will work. But this is just some things to remember, and just to remember that also the first 3 levels here at the bottom are really technology-based, and that's where Twitter's power comes. The top levels are really powerful as well, and you can combine really good one-on-one support for people at this level. We've, as I mentioned, used the post method and this engagement period and a couple other strategies out there to develop our own strategy. And just at a high level, we've used email as our primary audience, primary tool to connect to our audience, which is healthcare providers, as majority of healthcare providers are very comfortable with this tool. But we're also looking at the future, and this is where we're looking at social media. This is where we're hitting Twitter and a bunch of other tools. We're definitely also using online engagement as well, and additional to other engagement tools. And again, you can listen to our last session to learn more about what we're doing and the details of this. In terms of Twitter, just to highlight from our last session, we have our council account, and that's our organizational level. But then we also have different initiatives. So for those that have enough steam and we want to have some spread on them, we've actually set up separate accounts. And as Christina mentioned last time, the first one is on surgery, the second one, of course, is on sepsis care, and the last one is on our Quality Forum conference. And each one we use for different purposes for those initiatives. And fortunately, on the line, I just wanted to mention and acknowledge all the wonderful staff that are participating on Twitter. And it's going to be really fun for having them on the line to help handle some of the tweets that are coming out. So thanks again. And as you can tell, these are their handles, and these are who they are. And you can see them on Twitter, and they'll be participating as well. So we encourage people to have a conversation at all the levels. And the point is that we're all trusted, and we're all using this for professional use to work collectively to improve how we do healthcare. So why are we using Twitter? Well, as Christina mentioned last time, it's a unique opportunity to engage with our colleagues, disseminate calls to action, or ways to get people to engage to larger audiences very quickly, and I think that's the key thing. The third point here is increase awareness on issues, build and strengthen communities, and promote learning opportunities for events. Okay, so the poll results are in. If you look to the right, you'll see where people stand. So here we can see that the majority of people are actually newbies. So I think it's about 45%. Amateurs are about 20, comfortable is about 20, and then we have 3 superstars, or 3% of superstars. So that's great to hear. I might have to pick on you superstars to help carry this forward. But it's great that you participated, so thanks for giving your answers. So that's good to know that a lot of you guys are newbies, and that the next amount are amateur and comfortable. So that will help me gauge as well in terms of how we present. So before we get started, I just wanted to say, let's review some of the homework. So I don't know if you remember from the last time, we also asked people to provide any toolkits or pictures of things that they think would be around quality improvement. And thankfully, we were able to get a response, and this thanks goes out to, we'd like to acknowledge Gary McGraw for doing the homework assignment, and he actually promoted the Scottish Health Council's Participation Toolkit, and you'll see it right here. So that's the one that he said was really useful. And if he's on the line, feel free to use Twitter to let people know more about why you chose that tool. But we really thank you for sharing this toolkit and letting others know about how useful it has been for you. So, probably a good question to ask, what is Twitter? Well, we wanted to just let you know that Twitter is a social network that enables users to write and read online posts. These are known as tweets, and they're limited to 140 characters. This is a free service that, can you believe, has 500 million active users who have actually generated over 340 million tweets. And that actually results into 1.6 billion search queries a day. So this is one of the reasons why it's also become one of the top 10 most visited sites on the internet. So therefore, moving forward in the future, for us working in healthcare, this might be a useful tool for us to look into and figure out how to leverage this tool for our collective power to really make change in our systems and actually improve care and connect with one another. So all this stuff is actually taken from our Healthcare Professionals Guide, again, Twitter for Healthcare Professionals. So feel free to, again, download this guide and you'll have it handy. Unfortunately, I won't be able to go through all these 8 steps on how to set up a Twitter account, but feel free to go through them, and if you have any questions, to connect with us, and we can help you get online. One of the things to mention here is that, and I won't be covering it, but I think it is an important topic, is after you set up a Twitter account, the big thing you want to do is actually follow those that interest you, and I think that's key. The more followers you have and the more people you engage with, the more stronger your network is. And I think that's just like in real life. When you meet people on the street or you go to networking events, I think that's the same thing you want to embrace on Twitter. Whatever you do in real life, you can actually do the same thing in Twitter. It's not just something that you need to worry about. It's actually the same personality you can have on Twitter as well. Okay, the other thing that Twitter provides, which are very useful, and we found them useful here at the Council, is that they actually have videos, and they have many, many videos that you can use. So once you set up your account, you can go through the videos, and they give you great tutorials on how to use Twitter. The other thing that they have are guides, and these are great for getting you started as well. And in Canada and North America, we use Twitter, and we say Twitter 101, which is basically Twitter introduction. Okay, so I think one of the things that was hard for me when I got onto Twitter, I wasn't always on Twitter when it first started. It took me about 6 months. It was one of those tools that were very hard. I was very comfortable on email, and I was very comfortable texting. And I think one of the things that are great about email is that it's fast, it's easy to use, and you can connect with people. And the same with text messaging. The problem with these tools is that email can only go to one group of people or one person, and not everyone else gets to see what you're talking about. So if you're very excited about a toolkit or you're sharing information or an event, you can blast it out in email, but the whole world doesn't get to see. And that's the same limitation about text messaging. If you blast out text messages, you're not able to actually have everybody look at them. So these are private, but they're still useful tools. The good thing about Twitter is that it actually gets to a larger audience, and that's one of the reasons why we want to use Twitter. And so we like to start with the Twitter talk. So how do we talk Twitter, and what is some of that common lingo? So what is a tweet? A tweet is a post on Twitter. It's similar to an email or text message, but it's just shorter and it's public. And we've just selected a sample tweet here from Helen, and here she's just mentioning that inspiring afternoon at the Great Ormond St. Hospital, highly systematic approach to improvement and amazing passion for health of the young. She sent this on July 9th. This is her tweet, and you can easily read it, and you can actually connect to her if you click on her name, and it'll go right to her. And that's very easy to do, and that's what a tweet is. Now, what is a handle? Sometimes people mention that word. Well, basically, it is how you identify people on Twitter. It's your username or your Twitter ID. And so here's some things you need to keep in mind when you create a handle. And many of you guys have done this already, but I think you can also look into it and figure out ways over time how to change it. It's easy to do, and it's actually, you just go into the settings and you can change your handle as many times as you like. So create a Twitter ID that reflects who you are, be concise and memorable, and the key thing is actually 2 things. Keep it under 10 characters if possible, and that's because if you have a long name, it takes up the whole 140 characters in a tweet, and you don't really want to do that because then people have a hard time writing you messages. The other thing to do is avoid the underscores. So for instance, a bad Twitter handle could be Helen Bevan with 2 underscores and 1980. That's quite long. But the good thing Helen did was actually she just shows her name, and that actually hits all 4 principles, right? So it reflects who she is. It's easy for people to remember. It's concise. It's memorable. And it's a little bit over 10 characters, but that's fine because that's her full name, and I think it's a better way to brand and identify herself. What is the @ symbol used for? Well, this is called the @ symbol, as you know, and you've seen them in emails. It's really important because it actually identifies accounts. It's just like an email address. If you write the handle wrong or forget the @ the person will never or not receive your message. So in real life, what you would write is something like, "Hi, Helen. how are you? On Twitter, when you talk on Twitter, it's really key. And what you have to write is, hi, Helen Bevan, how are you? So the key part here is this at Helen Bevan. If you don't put this at the beginning, and you just wrote her name, sorry about the big font, but on this highlighter, but it would never go to her. So it's really key to ensure that the at symbol is there and her name is spelled right. And that will go to her. And then she'll get it in her inbox, and then she can respond. What is a RT, or a retweet? So some people have seen this before. Well, it's really simple. It's just like forwarding an email. It's when you share information what somebody else has tweeted. So, for instance, if somebody has emailed you something and you really like it, you'd forward it to a colleague of yours. And that's what a retweet is. It just looks a little different. So if you had written a tweet, something like, for instance, September 13th is World Sepsis Day, click here to find out more information, and you want them to go there, and say I looked at that on my Twitter search, and I really like that, I could retweet that. And a retweet could look like this. So here's the RT, and I could write a little message at the beginning and say, can't wait. And then World Sepsis Day is who said it. September 13th is World Sepsis Day. Click here to find out more. So basically, I just forwarded that to my followers so they get to see it as well. I've seen an empty before. What does that mean? Well, empty is just a modified tweet. It's when you make changes to a retweeted message. So basically, here's the original tweet that I just had in the last slide. Can't wait, retweet. World Sepsis Day, September 13th. What a modified tweet could look like, if I didn't want to just retweet it and I wanted to make some changes on it, could look like this. And the reason why you might want to do modified tweet is actually you wanted to write something more. So I said, can't wait, who's joining in? So since I took up more characters, and Twitter only allows 140, I have to modify it to make it shorter. So what I did was actually say, September 13th is World Sepsis Day, and then more info. So I just basically shorten this, and that lets people know that I've actually modified it with an MT. What is a hashtag, or what is the pound or number sign symbol about in Twitter? Well, the number sign is used to organize information so that information is easy to find. So normally what you'd say in Twitter or in real life, you could say, I need help to find stroke materials. Any ideas on where to go? You could ask that question on Twitter. But if you wanted to be a little bit more strategic, what you could write is, I need help to find stroke materials. Any ideas where to go? And if you put this pound symbol or this hashtag, what will happen is you'll actually, on Twitter, this is the interface of Twitter, hopefully most of you are familiar with it, is that if you type stroke here in the search, you'll find all the top things that people are talking about on stroke. And it will come up here and people will see it. And that's the easy way, again, to organize information into a folder. So as we saw on the last slide, if I type this in and I clicked on stroke, if I just clicked on this, what would happen is you get this search result, and you get to see what other people are talking about stroke and connect with people. And that way you can follow people. And you can see here there's so many different people talking about stroke and sharing information. Again, it's not to say everything is credible. All it's saying is that this is what's happening on Twitter. You can choose what you want to read, just like you would in a newspaper, and go with that. So what else are hashtags important for? Well, trending. This occurs when a hashtag is used so often that it becomes one of the most popular conversations in the world or a specific region. This is called Trends Map, and it's a really good tool to see what's trending. So these are the popular topics that are being talked about in the UK, for instance, and in Western Europe. And you'll see here, when you type it in on Twitter and Trends Map, here's some of the popular topics. So I pulled this a couple days ago, and you can see, probably because you guys are having the Olympics soon, BBC Sport is being trending. Terry is trending. I don't know why aggravated is, but aggravated was magistrate. So these are some of the popular topics people are talking about on Trends Map, and you can actually see where in the world people are talking, always up to the minute, and see what's happening. Here's some things more to know about hashtags. So these are commonly used hashtags, as we mentioned. So people know these hashtags. So if you use healthcare or if you use stroke, a lot of people are talking about it all the time. There's also hashtags that are organic, and we use these as well. So NHS Change is one, for instance, that we've seen. And actually, it's really funny. So last week, when we chatted about holding these seminars, we just came up with NHS tweets. And it seems like this one, this Twitter hashtag is actually being used quite a bit. So these are some things that we've made up. And this is to encourage you guys as well to set up hashtags for some of the campaigns or initiatives or events that you're having, and you can set up your own hashtags. You don't have to really use these commonly used ones all the time. You can create your own and have some momentum behind them. There's also fun hashtags. These are the ones that I really like, and that's when you actually can show some of your emotion and your personality. And Twitter is all about using it for professional use, but you want to show people who you are. So for instance, you could say something like, today, some of you guys, and I'm really happy if you guys have done this, you were able to send out your first tweet. So that's great. People are really excited to see that. What I would do personally on my professional account would be something like this. Was able to send out my first tweet, happy dance. And you never know. If you clicked on Happy Dance, there might be people around the world who are actually using that hashtag, and that's pretty exciting to see. But again, it could be just me making it up, and that's really fun for us to use things like that to express emotion. Does everything on Twitter have to be public? That's a common question that's been asked, and one of the concerns with Twitter. Well, one of the things that they've done is to say, actually, you can actually send direct messages. So just like a text message, it's a private message. So these are private messages that you can send. So for instance, you can say, hi, Helen Bevan, how are you? As you saw on the last one, that goes out to the public. Everyone gets to see you doing that. And sometimes maybe you don't want to do that. You want to send it privately. So what you could do is send a direct message. So the way that you want to talk in Twitter for direct messaging is to put the letter D and then her name as it is on Twitter and then the message, whatever you like. Notice here you don't need the @ symbol. You don't need this at all. All you need is the D and then her username or Twitter handle. And that will go right to her. Again, you're going to have to experiment like you do, make mistakes as you would be learning any other language. I've done the same thing when I've tried to learn Spanish, and, you know, people are okay with it, and it's good to be honest. So here's the @ symbol, the hashtag, the retweet, and the direct message. These are the 4 main things that you need to remember. If there's anything else you don't remember, these are the 4 things you should know if you're trying to learn Twitter. These are the 4 things you need to use and get really familiar with. Again, not to be scared with. I think these are really interesting things, and the more you practice, like anything else in life, the more you'll be comfortable with these tools. So let's hope that we've actually learned them. Okay. Next question. This is probably a good check for me. It's a temperature check. How's my speed? Am I going too slow? Move along already? Is it just the right speed, or am I talking too fast, and I should stop talking in Twitter speed? Let me know. The poll's on the right, as you can see, and you get 3 minutes to answer this one. And I'd love to get your feedback, and then I can accommodate where you guys are. So, do tweeters ever meet up? Do people who tweet, do they ever meet up? Well, yes, it's actually called a tweet up. This is a meetup of people who use Twitter. So basically, it's those that have share a common interest, and they want to meet together. So it doesn't mean to say that all tweeters, all the people that go to these events are tweeters. It just means that people come together and they get to learn from one another with a shared value. So some of them could be on Twitter, some of them don't have to be, but they all come together to learn who each other are. Sometimes people just talk on Twitter and they've never met in real life. This is a chance for them to meet in real life. In Canada, we have a great group. It's called Healthcare Social Media Canada. So that's the hashtag here, and they actually do meetups and Twitter chats on the internet, on Twitter. But they also meet in real life. So this is just an example. Last February, where people across Canada were actually meeting in their home cities, and they got to meet other people who were actually on Twitter that care about healthcare. And it was really phenomenal to see all this energy and all these groups meeting using this tool on Twitter. And it was very organic, and it was wonderful. And I think it was one of those great things to do. So if you're interested, I think a tweet up would be a really good thing to explore once you're more familiar with using Twitter. Now, of course, just like in emailing, what happens if you make a mistake on Twitter? So not to worry, you can actually delete tweets, or if it's an honest mistake, you can correct yourself like you would in an email. If you forget to attach a file, you would follow up with a secondary email, either saying, here's the file, or you'd admit your mistake. Because on email, as you know, you can't really withdraw an email. You can recall one, but people can still see them. So you can definitely delete tweets. But sometimes, if it's an honest mistake, we're human. Feel free to just send a second a second tweet that shows it. So, for instance, just on Friday last week, I said, "What an amazing guide for doing improvement work in healthcare," and I wrote the hashtag. And I don't know if you guys see, but I actually forgot the link to the guide. So even though I said it's a wonderful guide, and I used the hashtag, and I was really excited about my tweet, I actually forgot to include the link, and that was unfortunate. But I did write a second tweet that said, "Oops, here's the link," and I actually provided a link so then people could see it. And the beauty of that was 3 people actually looked at it. So this is Julia Scott. I'm not sure if you're on the line, Julia, but if you are, hello. Thanks for looking at the link. And Jackie Fowler looked at it, as well as Stephen Powell. And again, I don't know these people, but because I put this tweet out to the public, people were able to see this toolkit and use it. And thanks again for you guys for reading it and conversing with me on Twitter. So, again, this is Twitter Basics. We covered what a tweet is. We covered what a retweet is. We covered what the @ symbol is, a hashtag, a direct message, and a tweet up. So hopefully that was useful for you, and that's one of the big things that we wanted you guys to learn. So the poll results are in. If you look, it looks like the majority of you, which is really good to hear, 70% of you, are comfortable with the speed that I'm going at. So I'll continue going at this speed. Thanks for letting me know that. Okay, so 10 things to keep in mind while tweeting. Now that you know what you're doing on Twitter and you're comfortable with the lingo, here's 10 things you should know to help you get advanced and become that superstar that we need in healthcare. So, first, people are more apt to value your tweets if they include relevant and interesting content. And that makes sense. That's just like in writing your emails or if you're writing a report, you want to ensure that you have relevant and interesting content. 2, be two-way. Ask questions, and don't be afraid. I think that's the one big difference with Twitter. It's a social platform that's open. So feel free to converse with people and learn from others and have conversations. And it's really about asking those questions to get at the meat of things. So make tweets engaging and informative. Feel free to crowdsource for information or feedback. And the main point here is to be engaging. Definitely you can be one way and just give out information like here's our new report or here's something of interest. But if you talk one way, as you know when you see people with flyers on the streets and they're handing you a flyer, you're like, I don't really care about what you're talking about, but that's nice you gave me a flyer. The main thing with Twitter is actually rewiring our brains to be two-way in asking those questions like, hi, how are you? And learning more about the person and then conversing with what you're trying to connect with them on. And I wanted to just share an example. This is really exciting. So this is a conversation that just happened just about a week ago or just before our last session, and this is with Dean Gustini, who's a librarian here in Vancouver, Canada, and he works at the University of British Columbia. He's a librarian again, using Twitter, which is fantastic, and he's actually one of the world leaders who's a librarian using Twitter. And as you can imagine, the amount of information he's sitting on within the academic literature to actually disseminate that. So Twitter is a powerful tool for him to actually share different academic journals and articles that are coming out, and he's been able to effectively do that using Twitter. There's also Eagle Dog. She's a librarian actually from Seattle, as you can see. And fortunately, this is a conversation that was actually spurred from one of my colleagues here, Shari, and she's a quality leader with me here, and she's done some great work. And she's just also experimenting with Twitter and learning how to use the tool a little bit more. There's also Denise, and she's come from University of Alberta here in Edmonton, Canada. It's a different city, but a different area. There's Linda Ong, who's the Director of Communications at the UBC Library with Dean, and Research Girl, who's, I believe, a health researcher. Again, I don't know these people personally, but it's interesting to see that these people have connected using this tool. And this is how it went. Dean put out on July 5th a shout-out to Denise from Canada. Are other Canucks there? Did you hear about UBC Library and it's wanting to close down 2 hospital libraries? So it looks like Dean just put on Twitter a question. He wanted to engage with his followers and people who are interested in the topic of hospital libraries closing down. So he put that out on July 5th. And Nikki responded, who again was from Seattle, why would any academic library want to close hospital libraries? Did I miss something? So she responded to Dean. The second thing that happened was that Shari responded and saw that tweet because it was public, and she said, Dean, say it isn't so. Hospital libraries are very important to clinicians working to deliver best practices. And then Dean responded, and you can see that here, he responded to these two people and also Research Girl, what's next? Right, I'll have more information tomorrow. But he did also make a little joke. He said, I may have to retire in my 40s. Let's hope it's a joke. Anyways, what happened next is then Research Girl said, Dean, not if we have anything to say about it. Don't mess with researchers. And then lastly, she also said, not to mention hospital libraries are essential for training and residency. And what will hospital research institutes do? So again, by this simple question that Dean asked, he's gotten all these people to engage. This was all in the same day. Linda Ong saw these tweets, and then she said, hey, listen, everyone, UBC hospital library service models are still being discussed. Direct message me for details. So she's saying, hey, everyone, I actually have some resources for you. So Shari responded and said, thanks for sending my message to support hospital libraries to the Deputy UBC librarian. So what happened was Linda saw the tweet from Shari, and she sent it to the Deputy UBC librarian to let them know what was happening and that people care about these libraries that are being shut down. And Denise, as I mentioned, was from Alberta, which is a different province, connected and said, Dean, is Sandy Campbell from University of Alberta also here? She had not heard the news, so you'll have to let me know more. And then Nikki, who's from Seattle, connected, and she said, is there a blog or is there any other resources on this? She'd love to learn more. And then Shari responded to Nikki and said, if you direct message me, I'll email you, and I can get you in touch with the Deputy University Librarian. So this was all spurred within 24 hours, and all this conversation happened, again, just from a simple question that Dean put out there. And the key thing is to see the connection point between people in Vancouver, Seattle, which is in Washington in the States, as you know, and Alberta. And it's all about these libraries. And it's really interesting because I was chatting with Shari about this. Nikki and Shari connected afterwards, and they actually got in touch. Shari helped Nikki get in touch with the people here in Vancouver. So the Seattle librarians got to connect with the UBC librarians and the Vancouver librarians, which was the first time. So within 24 hours, they're able to connect two cities in such easy fashion about sharing resources about hospital libraries and where to go from there. So the third point, in terms of the 10 things to keep in mind with using Twitter, is when tweeting, try to keep it short. And I know that's really hard, and that's one of the advantages of emails. But you want to try to keep it under 120 characters. And then that's key. It's sort of like a headline for a newspaper. You got a bandwidth. You can't go longer than that. So a headline on a newspaper, you have to make the biggest bang every time you send out a headline on a newspaper. The same thing with Twitter. You want to send out every tweet in a way that's like a headline for a newspaper, so that people read it and get jived up about it. And I think that's the key thing. This is that way people have room to easily add a message when you retweet you. So this is about the point around keeping it under 120 characters. If you take up the full 140 characters, then people, when they retweet you, will have a difficult time to do that. And they also can't be able to write a message in the front of that, as we saw with the modified tweet. Now, the good thing to remember, this is a big struggle I had for 2 or 3 months, and I was so happy that somebody told me this, is if you have a lot to say, try to break it up into several tweets rather than having one long one. So if you have a lot to say, just make it 3 tweets instead of 1. I think that's really key to get you moving forward. The fourth thing to remember is to provide credit for sourced information. The reason we want to do that is that if you mention people that are having an event or have written an article, it's really key because then it actually gets them engaged in that conversation. This will help you connect with a larger audience because those people that you mentioned and sourced in that tweet, they'll actually get it on their feed, and then they'll be able to retweet you, and others will get to see it as well. So that's a really key thing to do, is to mention people and credit the information you get it from. Now, a good question is, how often should I tweet? I think this is a key question, and I think it's really up to you. You can tweet as little or as frequently as you like. Some people, they can tweet a couple times a day, and that's fine. Some people, they like to tweet 10 times a day, and I think that's also fine. It's up to you and the content that you'd like to share. Now, I wanted to mention as well, in our Twitter strategy, our council, when we tweet, we don't tweet 10 times a day, but we do try to tweet as much as we can when we have really good information. The key thing on Twitter that I like to remember is in real life as well is like when you think about how much information you share, say out of the 10 things you share, you try to keep a balance between what you're doing and what others are doing. And I think that's really key, just like in real life. You don't want to always talk about yourself. So out of those 10 tweets you sent out, not all 10 tweets should be about your organization, what you're doing, because then people will tune you out. But if you start sharing what other people are doing, I think that's really key. So say you had a ratio of 50-50. Here's what we're doing at the council, or here's what we're doing at the NHS, but you can also share what others are doing across the world and other centers. And I think if you kept that blend, that would be really useful. The other thing to remember is also our initiatives. Again, we don't tweet 10 times a day for each of these initiatives. We try to be strategic with the tweets. So when we have a campaign or we need somebody to sign up to something, then we get active and we get people behind it. So that's when we start using them. And again, for instance, our quality forum happens once a year. There's no point in tweeting all throughout the year, all the time, 10 times a day. But when an event is happening or just before the event or just after the event, we do start picking up the number of tweets. Again, we try to be strategic. And again, for our staff, if you guys are running organizations or part of organizations, the point is to look at your staff mix and try to get them engaged on Twitter. Again, don't be too strict on how many tweets they send out. It's up to each person, and I think that's the key, is to have fun and to let people experiment and tweet as much and as little as they like. The sixth thing to remember is to tweet at people. So that just basically means that having conversations with your followers pays off. The more you talk with people and the more you engage with them, the more that you'll have other people seeing what you guys are talking about, as you saw with the Dean example and with Shari with the libraries. The more people mention people, the more others that follow them will see that. You can mention your partners or other organizations. They might retweet or start a conversation. And also, if you feel like and you see something relevant, include your team members. And this is really key, because then you get other people engaged in the conversation and you get them excited about what you're talking about. Use hashtags. So again, we talked about hashtags. That's the #, right, this one. And I think the key thing is to use them. Now, the other key thing is don't overuse them. So you'll see with this example, a normal tweet could look like, the surgical checklist is a great tool for quality improvement to reduce complications in the hospital. And I hashtagged here surgery, and I CC'd a tool because, you know, he's one of the key people who've actually embraced this tool and actually promoted it. So this is a normal tweet. Now, the other way, when you're a newbie, I did this mistake as well, is to tweet and use a lot of hashtags. So here you'll see the surgical checklist here and here in checklist is a great tool for quality improvement and to reduce complications in the hospital. And then I hashtag surgery. So here we've already used, 7 hashtags. The problem with this is it makes it hard for people to read because there's so many hashtags. And also, as I mentioned earlier, as you know, hashtags, some of them are very defined and they have a lot of information, and some of them don't. So I'm not sure what would happen if you put this into Twitter or tool or checklist or surgical. They might not have as much momentum as, say, surgery would. So you don't really need to use all of these hashtags. You just want to be a little bit strategic. Again, if you're starting out, don't worry. Make these mistakes. It's fine. It's honest. The more you experiment, you learn. You don't really need to use all these hashtags. But it is important to use them when you want to be strategic and get the information to a larger audience. So when should I tweet? Well, it's up to you. And this is more about how often you should tweet and how. So the main thing to remember is when you have time to tweet and when you have something to share. Or say, for instance, you're at an event. These are the things that you want to remember. So, again, as we mentioned before, you can tweet as often, as little as you want in a day, but it's also when you have time. And I think that's the key thing. When you're reading something that's really educational or you're reading something that's very exciting, either in the news or a toolkit, feel free to share that like you would when you work in an office and you want to talk to your neighbor and say, hey, look, did you ever see this toolkit? Well, you can use Twitter the same way and share it with the larger audience so the whole world can see what you're reading and why it's so effective in terms of what you're working on. One of the things that we did at the council was that we actually attended a seminar with Hootsuite, which is a really great social media dashboard program, and HubSpot. They had a seminar last week, and it was phenomenal. It was actually they actually hold the Guinness Book of World Records, if you can believe this, for the most attended webinar in the world. And they were actually using Twitter to help facilitate that dialogue. And Dan Zarella here, that I've mentioned at the bottom, was one of the facilitators, and he looks at data. He loves looking at analytics, and he takes all this information on various different tools. So I highly encourage you to look him up if you want to learn more about the analytics of Twitter and Facebook and all these other tools. But one of the things that he did was aggregate all the information and analyze the information on Twitter and seeing where all the tweets are. As you saw, the huge numbers of 500 million tweets, well, he looked at that information to see when the best time of day was for a retweet. So that's when somebody forwards it. And what he found through analyzing all that information, roughly around 4 to 4:30 was the time that most people retweet information. And I think that's key to remember, too. Just when you're sending out tweets, you can try to aim them for the afternoon if you're sending out tweets. It really does help to get more retweets. So, for instance, say you were reading something at 6 in the morning. Well, not many people are awake at 6 in the morning, so you might want to share that a little bit later in the day. And I'll show you a little tip on how to schedule tweets. You can actually do that. Just like an email, you can schedule emails. You can actually do that on Twitter as well. So you can have it for a little bit later in the day. So when should I tweet? As I mentioned, this is our 8th principle. You can also schedule tweets to provide a framework for discussion throughout the day and avoid sending multiple tweets all at once. So as I mentioned, Hootsuite's a great tool for doing this, and I'm a little bit biased because Hootsuite's here in Vancouver, but they're a great company and they do great work. It's, again, just like Twitter, and the advantage of using a tool like this, there's many other tools out there, is that you can actually schedule tweets. So this is just a sample interface of how you can send out a tweet. So for instance, here's a sample tweet, Twitter Club for NHS Change Model, happening tomorrow at 4 p.m. All are welcome to join. Here's a link, and here's the tweet hashtag that we're using here today. And as you can see here, a calendar, and also the timing here. So what you can do is actually schedule the tweet. So instead of sending it, say, at 11:20 a.m., I can actually schedule it today in the afternoon, as I learned, and I can change the time to 4:30, and then press this little button here and schedule it. So I think these are really cool tools when you're sending out tweets to actually send it out a little bit later in the day. So for instance, say you're reading an information or you have really interesting quotes that you read, instead of sending 10 of them in a row, you can actually schedule them throughout the day or throughout the week as well. And it's very advantageous. The other thing I wanted to mention about Hootsuite, which is very useful, or any of these other social media dashboards, is, and Christina mentioned it last time, is that you can actually do a lot of real-time analytics. So I've actually, for you guys, shared our information in terms of once we started on Twitter, which was roughly around the fall of last year, and to today. Here's the analytics. So as you can see, you can get a lot of information here. So we've had almost, 2,500 clicks on links that we've shared. That's a lot of links that we've put out, and people have looked at it and used that information, and they come from a variety of different sources. For instance, our partners and TweetChat and LinkedIn, and majority are coming linked, direct linked. Also, as you know, our target audience is here in Canada. That's about 70%. But putting it out in the public, when people click on our links that we put into Twitter, you can see all these different countries involved in our tweets and clicking on things. And it's great to see that engagement because we're sharing information that's hopefully useful for people interested in quality work around the world. So that's really exciting to see. And again, with tools like Hootsuite and other social media dashboards, you can actually do a little bit more analytics. And I just wanted to show you two things that were really key here, is that job postings are really, really popular. So if you have job postings that you want to share with your colleagues, just like on email or on websites, you can use Twitter. And this was our most, in all our tweets that we sent out in terms of links, this was our most tweeted topic. We can see here 334 clicks. And this was just a posting that we had here at the council. And again, the second most tweeted thing was, again, related to jobs. And the second thing we wanted to show you here is number 4, and we just wanted to thank you again. Our 4th ever largest clicked link was actually the presentation we did last week, and it was really exciting to see that it had 50 clicks so far. And again, the problem with analytics is that we've used different shorthands, and so there's probably many versions of this, but to see that out of all the things that we've tweeted about, of the 2,500 things that were clicked, this is one of the top 4 things people have clicked of all time, and that's pretty exciting to see. And so thank you again for clicking on that and sharing that information. So this is not to scare you, but this is just to show you all the different tools out there as I started talking about Hootsuite. TweetDeck was actually based in the UK, and it actually just got bought out by Twitter.com, and it's just another social media dashboard that you can use to look at all the different social media tools out there. So, for instance, TweetDeck and Hootsuite, you can look at multiple Twitter accounts. You can also embed your Facebook and manage all those accounts all at once and send status updates. So many different organizations that are involved in communications and engagement use these kind of tools within their teams to help manage all that information overload. Now, if you have mobile phones that are smart, here's some really good ones. I've heard OpenBreak is great. Unfortunately, I don't have a BlackBerry, but if you have a BlackBerry, OpenBreak is great. EchoPhone, Uber Social, and Seismic are great for iPhones and Androids and many other platforms. Some other cool tools that we've been experimenting with, Christina mentioned this last time, is Storify, which is phenomenal as a tool. There's also Twitterfall. It's a tool to make a Twitter wall. So if you're holding an event, and you can see in this photo, thanks to Greg from the Health Quality Council in Saskatchewan, Greg sent me this photo. But this is a Twitter wall from one of our events, and it basically shows a real-time wall of all the tweets that are happening. Outly is a shortener. Clout is actually a tool that you can use to measure your clout or your presence of engagement on Twitter, and it actually gives you a score, and I'll get into that in a minute. And there's also Paperly, which is basically an aggregator of tweets, and it makes you automatic newspapers based on your tweets. It's a really cool tool. Again, I encourage you to look into it. Unfortunately, I won't have time to get into all these tools. Maybe we can have an advanced Twitter, but these are some really interesting things that we can use. So I hope you guys are doing okay out there. It looks like about 152 of you are there, so I'm glad you guys are still participating. Sorry I haven't taken any breaks. I'm trying to get through a lot of information, but we're almost there. So again, thanks again for participating and listening on. Again, this is an hour-and-a-half session, and we'll have another half an hour to go, and I'll keep running through this. So as I mentioned, here's the cloud score. So for instance, this was done a while back, but our cloud score was 42, and it shows how effective we are on here. I think Oprah is something like 80. But the point here is to say this is how we're doing in terms of engagement, and using all the analytics that are available on Twitter, Cloud uses this to manage your score. Again, I'd encourage you to set up a Cloud account and integrate it to your Twitter just to see how you're doing, and it's interesting to see what happens. And they have a lot of information there, and I encourage you to go there. The ninth thing to mention is to provide links, and you've heard me say this implicitly, but it's really key to say it, is to provide links. So there's actually tools out there that provide things to be shortened. As you know, you only have 140 characters. So for instance, here's that link. That's the actual link for the change model. It's quite long. It'll probably take half your tweet, so might as well try to make it shorter. And again, you can use tools like Hootsuite, or you can use Twitter itself or other things, and they actually automatically shorten them. So again, as you saw here with the Hootsuite dashboard, if you put your link in here, you can actually shorten it and press short, and it'll actually make you one of these bit.lys or outlies. Another thing to remember about links is that they should be put at the end or in the middle of a tweet. So for instance, if you send out a tweet, Twitter Club for NS change model at 4 p.m., all are welcome to join. As you can see, I put it close to the end. That's good etiquette on Twitter. Bad etiquette would be to put the link at the beginning and then mention everything else. So that's just something to keep in mind when you send out your links. Now, this is again from Dan Zarella, the person who works at HubSpot who does analytics. Basically, he showed that those that have more than 1,000 followers on Twitter actually have more followers, and that's because they put links in their tweets. Those that have less followers actually don't link as much. So those that have the most followers link a lot, and that's the thing to remember from this slide, is that the more you link, the more people will follow you. The less you link, the less followers you'll have. So it's good to have those links available. The other thing that I learned from Dan just last week, which we kind of didn't realize, but we kind of did it organically, was that if you want people to retweet you, there's a sweet spot. So 60 to 80% links is a sweet spot for retweets. So and what that means is when you're tweeting out, if 60 to 80% of your tweets have links in them, you'll have the highest percentage of retweets, and that's what he's saying right here. So again, he's just looking at the data, and he's just making some analysis on it. But the point to take away from this is that the more you link, the more retweets you'll have, because you're basically sharing information. The last thing to remember when you're using Twitter is to avoid unknown or informal abbreviations. And so what we know is that you only have 140 characters, but actually 120 characters. It's best to avoid acronyms. And the reason for that is so that people can understand you and it's clear on what's being said. So try your best to avoid shorthand. So things like great and writing the number 8 in there, or 2 for 2, or 4 for the word for, or U for you. Try to avoid these as much as possible. And we know it's hard to do, and in many of the modified tweets or retweets you might have to do that. But the point here is to try to avoid those shorthands. And another reason why you want to do that is to be clear. And then we know in healthcare, acronyms are used and overused, and it makes it very difficult for everyone to engage. So for instance, as an example, if on Twitter you put ACT, it could mean a blood test, or it could also mean a drug. So you want to be very careful on how you do that. In addition, outside of healthcare, ACT is a commonly used acronym for Higher College of Technology. So when you're engaging the whole world, you have to be very careful on what shorthands or acronyms you're using. And again, you can still use them, but it'd be good to define them as well. So those are the top 10 things to keep in mind while tweeting. This is page 4 in our manual. Feel free to refer to it. Another reason why I mention that is because I don't want you to be going away from this and going, wow, he talked about a lot of things, and I'm not available, I'm not able to keep up with that. But these are the things that you want to look at in our guide, and it'll help you use Twitter. Okay, so those are the top 10 things. I just put this in the slide deck so that you have it on SlideShare. Here's 5.5 things. So if 10 things are too much to remember, here's 5.5 things to remember on Twitter. And I think this is a really good tool that NJI Media has developed, and I would encourage you to look at it. Again, it will be in our SlideShare. Feel free to look through it. I won't have time to go through some of it, all of this today, but I think one of the key things for me was a takeaway was that in 2014, they're predicting that mobile internet usage will be overtaking desktop usage. So can you believe that our mobile phones will be used more heavily than desktops by 2014? So that's less than 2 years from now. So that's pretty interesting. Anyways, I encourage you to look at this because it's less than 10 things, it's 5.5 things. Now, if there's 10 things is too much and 5.5 things are too much, here's 3 main things to keep in mind while you're using Twitter. One is to keep your tweet short, as I mentioned before, and include links. So keep your tweet short and include links. The second thing is to use hashtags, but don't overuse them. And the third thing to remember is to mention people. So when you're sending out tweets, here's the 3 things to remember. So if you can't take in all the 10 things that I mentioned or that we've covered here today, or the 5.5 things on that other graphic, here's 3 things to remember. Okay, well, let's get our hands dirty. So thanks again for carrying on with me throughout this whole process. We really appreciate Christina and I here over at the council. We wanted to get an experiment. So this is where we're going to try something, and let's see how it goes. I'm pretty excited about seeing what happens from this. So I think before we start this Get Your Hands Dirty interactive session of the seminar, I wanted to just say, what could we tweet about? So just keep that in the back of your mind, and I just wanted to put something out there. I'm not saying that we do this, but this is a very interesting thing that happened, and I'm not sure if you followed the news, but earlier this year, I wondered if people thought tweeting about a live brain surgery would be a good idea, or would be something that you could do on Twitter. Well, interestingly enough, a hospital in Texas earlier this year in May actually did that. They actually live tweeted a brain surgery. And this is Dr. Koh, I believe, at the Memorial Hermann Hospital in Houston. And actually Dr. Kim, actually did this surgery. And this is actually in your Guardian newspaper, and you can learn more about this live tweet. But I just wanted to pull up a couple sample tweets that were happened So Dr. Kim here begins drilling into the skull with a perforator, making several small holes. And then they put a hashtag, stand by for the video. So they're actually going to have a video of this procedure. And another tweet that I thought was very interesting was a patient is neurologically intact. She's walking, and she will be out of the ICU this AM, relieved the tumor is removed. This is Dr. Kim's quote, and again, they tweeted this out. So, you're saying, why would they tweet out a live brain surgery? Well, the good thing is, as you can imagine, is people who might be going through a brain surgery in the future, or families and colleagues, they might want to learn more about a brain surgery, or people in medical school or nursing school or in other health professions might want to see what's happening. This is a great way to actually take it and break it apart with videos and with tweets. And the other thing you can do, again, with Twitter is share photos. And so they are actually able to live tweet photos during the surgery. And I'm not encouraging everyone to do this. All I'm saying is that a group in the States have done this. Okay. So I thought what we could do is start with a whiteboard experiment. So there's about 135 of us. This is going to be very exciting, and hopefully some of you are comfortable with the webinar tools here with WebEx. But let's try a whiteboard experiment. So I wanted to ask a question. So if you guys are ready, hopefully you guys can join in. Which country are you cheering for in the 2012 Summer Olympics? So I'd love to hear what you guys think about which country you're cheering for the 2012 Summer Olympics. And I believe it happens next Friday here in the UK. So I'd be very excited to see what you guys think. So let me just share my whiteboard, and hopefully you guys are able to see it. There's actually right here a little T, and you can click on the T and set up a text box. And oh, look at that. So somebody's cheering for Canada. It looks like Canada's first off to bat. Feel free, all of you that are still online, please tell us which country you're cheering for 2012 Olympics. Great Britain. And what you need to do is actually click off after you finish writing to another part of the screen to have it showcase. Okay, I've just realized that we're not able to actually use this tool for everybody. For some reason, we're having a technical glitch. But again, it's technology, so you get the gist of it. So this is the whiteboard, and we asked that question on a whiteboard. And I'm sorry about the problem, but it's great to see. So let's just see the examples that are here. I'm going for football for Coventry and supporting Mexico. Great Britain, I'm going to the athletes to see Jess Innes win, which is exciting. So it looks like maybe just the panelists can actually do the exercise. But that's great to see that it actually worked. So let me just go back to our what's a tweet and presentation. So thanks for participating, those that did participate. So as you can see, who is the audience of the whiteboard? Well, as you can see, it's only us. So other people can't see it. Anyone who's tuned in does get to see it, but only us. When you're on Twitter, the whole world gets to see it. So I think that's one of the great things to try. So what we want to do is actually look at this tweet right here, a sample tweet, and actually see if we can actually tweet this out. So before you do this, I just wanted to say this is a tweet that we'd like to send out. As you can tell, it has 2 hashtags, so that's great, so other people can find out about it. So the other thing it has is a link, which is great. And the good thing is, we've also did the little 20-character test, and it actually has 20 characters left. So it's really good tweet. And if we go back to the checklist of 3 main things to keep in mind, is it short? Yep, it meets that. Does it have a link? Yep. Does it have a hashtag? Yep. So it meets those conditions, but it doesn't mention anyone. But that's okay, because I think through this exercise we'll be able to showcase that. So the other thing I added was a please retweet at the end. Now, if you're doing a campaign, sometimes you don't want to do that, and sometimes you do. It really depends on what you're doing. Again, when we look back at what Dan Zarella says, he, again, analyzed all those 500 million tweets out there, and he says that people that write please retweet or please retweet in different forms have a significant, again, if you're an academic and you care about analytics, it has a significant amount of retweets. So basically the stat is you get 4 more retweets if you write the words please retweet at the end. So for our sample exercise that we're going to try in this live experiment with all of you is to do that. So your task is to retweet our tweet. So what we're going to be doing is actually sending out a tweet. So the council, which is the BC Patient Safety Quality Council, will send out a tweet right now, and it will say the tweet that we have up here. And your job is to retweet that and to write something at the beginning if you like, or you can just press the retweet button and quote it, and it can be sent out via Twitter. So those that have a Twitter account, you'll be seeing this, and those that don't, we'll play along, and I'll basically verbalize what's happening on Twitter, and I'll demonstrate what's happening. So just to recap, the point is to tweet away. So search NHS Change on twitter.com, and then retweet the sample tweet that we just put out on the council. And feel free to add your comments on the end of it. Yeah? Okay, I just got the go-ahead from Kevin, and I believe he works with us here at the council, and he just sent out the tweet. Hopefully you'll be able to see it, those that are on Twitter. So if you do see it on Twitter, now please go in and retweet it. And what I'll do now for those that aren't on Twitter is just to show you and verbalize what's actually happening. So now this has been tweeted out, and now people are retweeting it, and they're adding their comments. So the beauty of this is twofold. One, people on the line, like the whiteboard, can see what's happening and retweet it with each other. But the beauty of Twitter is people have followers. So you might have 10 followers, you might have 100 followers, you might have 1,000 followers. When you tweet out something, those go to all your followers. So if this is being tweeted out, here at the council we have about, I believe, 1,500 followers, and so this will go to all our followers here in British Columbia and those that follow us from around the world. So will all the tweets from all the other people that are sending it out. And in addition, the second big thing is not just the followers, but we use hashtags. So the people who follow the hashtags, you'll be able to see it as well. Now, the great thing to see for me is that Twitter is going quite busy. We have Kath Evans. Thanks, Kath, for sending out the retweet. We also have Jamie Mithwin. Thank you for doing it. We have Practice Leaders. Practice Leaders just retweeted it. We have Antri PEF, so that's PEF Mentors. We have Chelsea here from the council. Thanks, Chelsea and Rebecca. We have Joan Shum. Thanks, Joan, for sending it to your followers. We have Richard. Richard just sent it to his followers. Anne Abassi. Thanks so much, Anne, for sending it out and for being on the line. We have the Northern Health NHS Service. So they've sent it to their 600 followers, and they've sent it out. Also, Jennifer Ross, who's Med Safety Bird. Thanks, Jennifer, for sending it out. We have Francis Newell. Thanks, Francis. It's great to see that you've been able to tweet it out. We have Stuart Hill. Thanks so much, Stuart, for sending it out. And we also have BC Squan, as you know, is one of our initiatives, and they sent it to their followers, who are the surgery people. So that's really exciting to see that we've already, within about 5 minutes, been able to see about 20 retweets of the tweet that we just sent out. So that's really exciting. So I'll keep that going in the background, and feel free to keep doing it, whoever is on Twitter still. I'll encourage you, Helen, and Christina to tweet it out. And if I get a chance, maybe I can try to tweet it out as well. Let's see if I can do that.
Hey, Ajay.
Yep.
Christina here. I just thought I'd let you know that so far on the NHS hashtag, we've had 146,000 impressions. So
wow.
Just a real-time example of the impact of that.
And how much was that, Christina, again?
146,000 impressions. There's 104 people, 289 tweets, this is in the last 24 hours, and 146,000 impressions.
Fantastic. That's great to hear. Thanks so much, Christina, and everyone else for participating in this challenge. And it's really good to see that. So,
and Ajay, just before you carry on, can you define what an impression is?
An impression is basically saying that, in a nutshell, in a high level, is to say how many people have potentially been able to see what you've just tweeted out. So it doesn't mean all these people have seen it, but these are the spread of what's happened. So as you mentioned, we have over 100,000 potential impressions or spread or potential people who've seen what we've just tweeted it out. So whether they've actually clicked the link, that's not what's happened, but it means that these people have actually had the potential of seeing this. And I think that's really exciting to see that 100,000 people within the last 5 to 10 minutes being able to see that, or with this hashtag. So thanks again. Okay, so let me just go back. If we can all go back to our slides, I'll just be able to end this conversation and then open up the floor to questions. But again, thanks for participating with this experiment. It was really fun to see, and I encourage you to continually tweet out these things and move forward in that direction. We wanted to also end, again, to remind people, Twitter.com is a great resource for people to use. Mashable is a great resource for social media, and I encourage you to go to Mashable. It's pretty much like if you guys are interested in quality improvement work or in healthcare, it's the same place for people who care about social media. Mashable is a place to go for that information. The other thing that's really useful for Twitter is the ultimate guide for everything Twitter. We found this is a very useful tool. So feel free to use these 3 tools to help you get started in Twitter and also continue on the journey using this tool. Final thoughts, we wanted to, again, if you haven't had a chance, please feel free to give us feedback and download this Twitter for Healthcare Professionals Introductory Guide. And if it's useful for you, feel free to use it. Feel free to modify it. We're comfortable with that. We want basically people to share this information and be able to use these tools. And as you saw with our experiment, tomorrow at the same time as today, the Twitter Club is happening for the NHS Change Model. We encourage you to join in and really use this tweet chat as an opportunity to practice your Twitter skills, but also to talk about how to help change healthcare, especially in the NHS in the UK, and make it improved. We're doing similar things in BC, so we're trying to do a quality chat on August 22nd. We encourage everyone to join in, and you can learn more on this link right here. So the last poll before we go into question period is, what was the most valuable thing you got from today? Here's 6 options. Was it learning the lingo? Was it the examples? Was it the same things to keep in mind? Was it the exercise? Was it everything, or was it nothing? I'm hoping it's not the last one, but I do encourage you to do it. I think you can choose one option. If you can choose multiple, feel free to. And you've got 3 minutes to answer that. And during the question period, we'll probably have the results. And thank you again for your time, and why don't I give it back to Helen? Hopefully that was useful, and thanks again for inviting us, and we're happy to answer any questions that people have, Christina and I.
Oh, Ajay, that was fantastic. And how you kept your energy going for so long was amazing, and I think the extent to which all of us really stayed engaged in that whistle-stop tour through being a Twitter superstar, I think was a credit to you. So what we want to do now was to open up for questions. And I know, Christina, you've been keeping an eye on both the hashtag and the chat box. So if what I want to do is to kind of encourage colleagues that are on are taking part to add questions in the chat box. If anybody would like to ask a question directly, can you put your hand up? But in the meantime, Christina, can you, in terms of what we're seeing in the chat box and what we've seen on the hashtag, what are some of the core questions that it will be helpful for you and Ajay to answer?
Sure. I think one of the first ones is around how do you search effectively, knowing that sometimes searching ends up with much more than you're looking for, even when you search for a hashtag. So, Ajay, any tips for, especially for people who are just starting out, and there were some questions in the chat room as well about how do you gain followers and how do you find the right people to follow, but also how do you seek out information? What are some ways to organize that information and to be effective on that?
Those are great questions, and I'm glad those questions were asked. Thanks, Christina and Helen. So let me hit the follower one first. Again, the beauty of this is to say that the more followers you have, the more captive audience you have. So I think that's the key thing. So if you have 10 followers, your tweet doesn't really go that far. But say you had 1,000 followers, then it goes a lot farther. So one of the things that we've looked at and experimented, again, this is just a little tip, is that say you wanted to follow, say you wanted followers. So one of the things that you could do is go to an organization that you believe in, say the NHS, or a person that works in the NHS, and look at who they follow, because they've taken their time and actually meticulously looked at who they should be following. So you want to go to them and actually start following who they follow. And if you look at their followers, say they had 500, feel free to follow like 100 or 200 of them and just go through the ones that you think are relevant for you. And say you did this experiment and you got 100 people that you follow now. Out of those 100, when they get a notification that you followed them and you have a good profile there, like a photo and a good bio and maybe a web link to your organization or to yourself, the key thing is then out of those 100, the statistic is anywhere from 10 to about 30% of those people will automatically follow you within about 3 to 4 days. So say you followed 100 people, you'll easily get 10 to 30 followers that way. And now say you did that experiment, and it only takes about maybe 10 minutes to do that. The other thing you can do is follow 1,000 people. So if you followed 1,000 people and it took you, say, an hour, you'd get about 100 to 300 followers roughly. And then what you want to do is engage those followers saying, thank you for following me, I look forward to the conversation, and you have a conversation with them. And then they'll stay being your followers. And then if you could put out relevant, interesting content, they'll love what you're doing and retweet you. So one of the things that we do is that kind of experiment. And I've learned that from my colleagues who are really active on Twitter. Some people have 100,000 followers, and they're good friends of mine, and they've taught me these little tips. So that's one thing about followers and how to gain them. The other thing to remember of followers is if you do follow 1,000 people and then you only have 100 followers, that ratio looks a little bit odd. So what you want to do is start deleting those that aren't following you back or those that aren't relevant. So you want to bring that ratio back of the number that you follow and those that follow you back. So that's the first question, I think, Christina, about followers. The second one is about searching, and I think that's a great thing. There's so much information there on Twitter, and how do you go through all that information? So one of the things you can do, again, as you know, is I showed you can do the search on any hashtag on twitter.com. The other thing you can do is also go to Google and actually just search popular hashtags in healthcare. Just Google that. Like we Google anything, toolkits in surgery. You can Google it and look through all that information. And I know that's a little cop-out kind of answer from my end, but I use that all the time. The other thing that we've done is actually in our guidebook, if anyone's had a look through our guidebook, is that we've actually put a link in there for popular healthcare hashtags, and you can click on that link within the guidebook. I'm not sure what page it is, but you can actually click on that, and you can get the most popular Twitter hashtags that are used in healthcare. So again, if you look through our guidebook for healthcare professionals, the Twitter guidebook, in there you'll see a link to the popular hashtags.
Thanks, Ajay. And then the other question was some discussion about over-tweeting. And is there a risk of annoying people if you tweet too much? Is less more than Twitter was a question that Rowan Myron had on actually on Twitter about how much should you tweet to balance that so you don't start to drive people a bit crazy. But also the question around should you limit yourself to one tweet, or if you've got a lot of information, can you do the 1 of 2 and 2 of 2 kind of scenario? What is your advice around that?
The last one's a good one, Christina. Thanks. And it was Rowan. So thank you, Rowan, for asking that question. I think the key on Twitter is to, you can definitely put part 1 of 3 and say, here's part 1 of 3, and that's fine to do. And we see that in blogs. People say part 1 of whatever if they have a piece that takes longer than just one page. So you can do that definitely on Twitter. And I think that might be helpful. In terms of over-tweeting, this is a funny thing. So as you can imagine, some people in the world like to talk a lot, and some people like to listen a lot. And I think Twitter is sort of like a mirror of that. So feel free to tweet a lot if that's your personality. People know you that way. So if you talk a lot in meetings or you talk a lot in real life, feel free to tweet that way. Don't be uncomfortable tweeting less or tweeting more. And again, if you're a listener and an observer and you don't have anything to add to the conversation, you can tweet a little bit less. So I don't think there's a problem in over-tweeting. It's really funny. I have a friend here in Vancouver. His name is Hummingbird604, and his name is Raul, and he actually tweets quite a bit. I think he just joined maybe a couple of years ago, and within that, I think he has about 10,000 followers, but he tweeted, I think, over 150,000 times. I don't know how he's done that, but he has. And, you know, people still follow him, and people like what he has to say, and I think that's really exciting to see. On the other end, you know, some people who are thought leaders, like Seth Godin and some others, they might actually not tweet. They might only tweet once a week, and I think that's fair too. So it really depends on how you want to leverage this tool and use it for your own benefit. And basically have fun. Try to experiment and try to find what is the right ratio for you and go at it.
Yeah. Yeah, and I think too, you know, sometimes there was just a point raised for people who are on Twitter about if you schedule tweets, try to spread them out by using that scheduling function so that you don't have a large dump all at the same time. So that's another example where the tools that Hootsuite and others offer for the scheduling can be really helpful. The other question I think that we had was around, again, the lack of access to social media and healthcare for staff as being a continuing issue. And I know that Dean had mentioned that there's some work going on right now to try and address that in the United Kingdom. But any thoughts around that?
Oh, I wish I could throw that one back at you, Christina.
I know you do.
Or maybe Helen. It's one of those things. So I think when we're doing our social change work or social movement work, we want to find tools that will effectively be able to get us connected, get us to share information, and work together and have that shared purpose. And I think using tools such as Twitter, not only Twitter, but using other social media tools, are really important to find ways to really open these things up. Again, we have to use it in professional ways, but people are using these tools, right? We know that, Christina. Like, people are on their iPhones or on their Androids, and they're using these tools to check their Facebook, or they're texting each other or checking their email. So we need to come up times, and I think organizations really have to look at ways to really liberalize their policies around this in a way that actually, instead of using it for personal use, them using Facebook or Twitter or any of these social media, why not we help facilitate that dialogue to use them for professional use? So it's nice to know what our cats are doing or what our children are doing. I encourage that. But why don't we also use these tools to really talk about what we're doing at our daily lives at work and really help facilitate that dialogue? And I think we really need to start looking at ways to do that. So, again, I don't have any answers to that, but I do encourage organizations to look at ways to review their policies.
Ajay, it's Helen. Can I add to that? You know, what I'd say is that it's kind of like anything that's new. You know, it's not going to be a case that everyone's going to do it at once. And in a sense, what we've got to do is learn from the pioneers and the early adopters. And there's a whole series of chief execs in the NHS that have really embraced Twitter and other forms of social media and are using it really effectively. And I mean, the ones that really stand out for me are Lisa Rodriguez in Surrey, Mark Newbold at Heart of England Foundation Trust, Rob Webster at Leeds Community Health. And you know, we can really learn, you know, from these colleagues and the way that, you know, that things are changing. We can also take examples from all over the world around, you know, social media policies and ways that organisations are working. So I think this is coming. I think it's just a matter of time. But I think the key thing is that, you know, we can learn from existing pioneers and existing good practice, and it's out there.
Yeah, and what I'll do as well, the BC government, our provincial government, has guidelines for citizen engagement specific to social media, which I'll send out a link through Twitter right now just so people can have a look at those. But I think it gets into some of the issues in those policy guidelines that were brought up last week as well about confidentiality and things like that, and I think they're a great example that people may find useful. So I'll send that link out right now.
Yeah, and you know, a really good example is what Birmingham Children's Hospital are doing. So Birmingham Children's Hospital is developing new mechanisms for dealing with feedback from children and young people and families, and they're encouraging feedback through Twitter. And all the tweets that they're getting are going to go on the front of the Trust website. And every month the Trust board is looking at what's coming in through Twitter. So rather than seeing it as something we've got to repress and stop, actually we're using it as an incredibly effective real-time mechanism for feedback, and you know, working with it in a very effective and courageous way. And I think it's where we're going. It's just a matter of time. So we're actually at 5:30 now. I can't believe that. An hour and a half has gone so quickly. So thank you, Ajay. You are a tour de force, you know, in terms of Twitter. And I think that there will now be a whole army of tweeters in the NHS in England, and from our international colleagues that are on the call, because we've got a number of colleagues from other countries as well with us, which is absolutely fantastic. What would be really wonderful is if everybody who's taking part with newfound or enhanced Twitter skills, if everybody, before you go, if you could just put one comment on Twitter with the hashtag NHS tweets, and if we could all, you know, just put a comment or a reflection before we go. So, you know, to everybody on this that's been taking part today, you know, if you would like us to run more sessions like this, you know, if there are some particular topics, you know, please let us know either directly or you know, or through Twitter. But that's been absolutely brilliant. So Ajay and Christina, thank you so much for today, and thank you for last week as well. I think that what you've given us in these last two webinars is a real boost in terms of our Twitter ability. And you know, at the end of the day, the reason why we want to do this is because we want to make a difference. You know, we want better care for our patients and our citizens, and this is a real mechanism for helping us with that. So thank you, and thank you to everybody that took part last week and this week. And you know, here's to the Twitter All-Stars, here's to the Twitter revolution. You know, let's go forth and improve and use our newfound or newly enhanced Twitter skills to help us do that. So thanks to everybody.
Thanks again, everyone. Thanks so much, Helen, for the opportunity. Christina and I just really appreciate and are humbled by the opportunity. So thanks again.
Brilliant. Okay. Bye, everybody.
Bye.
Bye.